Hello, and welcome to your mini lesson on care coordination, where we explore goal setting, decision making, and any barriers to be able to complete any referrals. So, when we look at care coordination and providing care coordination, the basic concept is that we're connecting participants and clients to services and programs that will enhance their health and well being and be able to help them in accessing and using those services more effectively. We do this through empowering participants to be able to be actively involved in their health care and to know their rights. And together we work with other team members as well as community providers to be able to really make it really easy to use the services that can meet their needs based on what they report. The overall care coordination process is often described as cyclical. In another mini lesson, you should have already reviewed what it is involved with the needs assessment. We practice administering a needs assessment, and usually that is considered to be the first step, and oftentimes the needs assessment is completed within a first appointment with the client. From there, we will be covering our goal setting, and in ensuing lessons, we will then be looking at the rest of this care coordination process in knowing our service area, connecting clients, and being able to follow up with them. So in the very core of care coordination, the ability to coordinate care or work together, not only with services within your own organization, but with others, also involves being able to identify and access those resources that may have potential challenges and barriers and how to overcome them and assist the client in order to be able to overcome them or take a different direction with meeting their needs. Essentially, we are trying to make appropriate referrals based on what is reported from a client through other services that may be available. And of course, one of our goals is to be able to identify with a client, working together and listening through their needs, the ability to have a goal action plan and be able to aid the client in prioritizing and developing a goal action plan for themselves. We use this to be able to coordinate our community health worker activities with other providers and other community services in the area in order to assist the client. It also allows us to be able to follow up and track any care and referral outcomes based on what we provided for the client. After our needs assessment, as we mentioned earlier, usually what we do is goal setting and action planning. We want to be able to take what they tell us and specify a goal and a target date, be able to understand where the client is and what they've tried and what their confidence level is in completing and meeting their needs. Also being able to identify any barriers as well as the strategies to be able to overcome them. We really utilize you as a community health worker to support them in reaching their goal. You're not making the plan for them, but working together to help them prioritize and decide. Along with this, we also discuss other supports and resources that may be available, and we try to help them break it down into a series of manageable steps to be able to reach the goal and follow up and track any progress. We often see that there could be potentially barriers to accessing services, as we know. And usually in that goal setting, it helps to think ahead a little bit. So things that we know about services could be things like co-payments or out-of-pocket costs, difficulties and challenges with transportation, lack of childcare that often happens, and any stigma associated with certain services, whether they are mental health or substance use, but also even just certain levels of pride with clients where they don't want to be involved in charity or receive welfare, and they might require some empowerment and assistance to know what their rights are in accessing these services. We can also have certain past experiences or mistrust with service providers, something that you should definitely explore, whether it's through the client themselves or oftentimes it's usually kind of word of mouth. Another friend of a friend or a neighbor had also tried or been in similar circumstances and been denied. So oftentimes we also have to kind of assess for those and be able to understand and listen to the client when they have those concerns. We also know that as community health workers, as much as we wish to assist, there's often sometimes lack of services based on what their needs are. There could be long waiting lists, such as like with housing authorities, which can go on for several years before they are able to receive any assistance. There could be changes in service availability. We saw this definitely during COVID, where we saw limited service hours and locations had to be changed or closed down during certain times. And of course, we know that there could be language or cultural barriers. One of the key things to know when services that you're going to be referring to is whether somebody will be able to connect with somebody who speaks their language, or whether you will need to assist them. And of course, some other barriers are knowing that if services are accessible by public transportation and have easy and ready access. And of course, restrictions on eligibility. We know that these could be things like they are only available to residents within certain areas, or if they require social security numbers or certain documentation that a client may not have or is unwilling to provide. So those are our first steps when it comes to care coordination. Thank you, and we will continue this up in another lesson.